Hi, thank you for having me so much, and I wish that I could be there in person like you all are. But my name is Alice Lara, and I am the director of the Sudden Arrhythmia Death Syndromes Foundation, or the SADS Foundation. And I have been with the SADS Foundation for over 22 years. The SADS Foundation is going into its 31st year, and was founded on one of these rare heart conditions that we're discussing today. So our mission, you have on the screen there, is really to do what you guys have been talking about so far. And I'm so glad to hear that you got the chance to get the story right from Maddie, because I think, and her mom as well. I think that is huge in terms of your understanding of what people go through. We talk to people every day in these situations, and what a huge life-changing event that is for everyone to get this diagnosis, to think that they might have other family members that are at risk, and to figure out how they need to change things in their life. And hopefully, as you can see, in our mission statement, that is our mission, is to support these families and to help them learn how to live large and live their best life that includes these genetic heart conditions that they have just been told that they have. So the other piece that I really wanted to point out from the moving story is that these are really patient concerns in terms of how to wrap their head around this and get in mind what they need to do. But really, the journey to diagnosis, and you heard what Maddie's journey was, and some people, as they said, take a lot longer, but that is still a problem for everyone. How long does it take? What do we have to do? How much do we have to fight to say there's something wrong, there's something going on? I think that's a huge concern still, and has been all these years for SADS Foundation. The other piece is risk stratification. Am I going to be at risk? How much risk do I have? When am I at risk? We don't really know 100% when that will happen. When are you going to have an event? So that still is in the research realm. We have some inklings of things to do and not do, like for long QT syndrome, there's a huge list of medications that you can't take, or it will prolong your QT interval and possibly cause an event. And then obviously the last piece is what I think a lot of you in this room are concerned with, and that is, how can I get better therapy? How can we find a cure for these conditions? So slowing the progress of ARVC, having better medications that protect people from the complications of ARVC, and really looking at what's next, and could I really have something like a gene therapy that is a one and done for my life? That, of course, is everyone's hope. I'm sure all of you are in this to find those as well. So I want you to know that the ARVC community that we work with is really engaged. They are very excited about all these new future possibilities, and are very willing to work with you to try and make it happen. At SADS, we really work with researchers, medical professionals, and family all together to try and make a difference in people's lives. So I just wanted you to know that. Can I see the next slide? I guess you're doing my slides, right? So the next one is really talking about our services. And we have these main areas. I just wanted to bring it out really quickly with you. Patient and family support is kind of what we talked about a little bit already, but we are here, almost 24/7, because nowadays there's a lot of social media, there's a lot of texting, etc. But we definitely have information on our website for patients. We definitely talk one-on-one with people, listen to their story. We have a referral network of physicians that we can provide if they need help with that. So there's just a lot of patient and family services that we provide, and I couldn't list all of them here. In the medical professional education, again, we're talking bench to bedside here. So we work with the world experts in all of our SADS conditions. But when you get to the clinician, that's really hard to know in these rare diseases. What is the newest? What is the most recent research? And how do we take care of these people? Or even how do we diagnose families or the kids? And so our mission is really to help that transition, to provide medical education so that the physicians that see our families really know what the best, most up-to-date care is. Awareness prevention is the broad awareness of the general community. What are the warning signs? When should you ask your doctor when you faint? We do a lot of work with schools in awareness prevention just to make sure that schools are safe, and we have partner organizations that we work with there, and make sure that all of the kids that have been diagnosed with a SADS condition in school are safe and that the schools know what to do. So it's a broad awareness prevention campaign that's sort of happening all the time. We have some specific months, obviously in Heart Month. That is a big piece of is our goal in Heart Month, is to make sure that everyone is aware. And I know that last month we had a huge event with Damar Hamlin, and everyone seen his cardiac arrest on the football field. And we did a lot of work last month that was pretty unexpected, but extremely, extremely useful in terms of where people were. They had seen this, they witnessed with their own eyes what happened. And so we could just say, go team, look what you did, look what you can as a person learn to do. And all of you here in this room should definitely be looking at that. You can perform CPR very easily these days. You can get the AED that could shock a person back to life, like you saw them do with Damar Hamlin. And that's sort of our message has been all along, but especially with that event, this can happen to anyone, anywhere. And you could be prepared as an individual person to save a life. And we are so thankful that Damar is alive and doing well. And I think that is great to show that, this is really important. And then research is, again, we work really closely with researchers in rare conditions. You need to have all the patients that you can enroll in research to be able to find all these new possible better therapies and cures. And so we have a network of international researchers that we work with all the time, and that we can then advertise, so to speak, to our communities and see if they would like to participate once things get to that point. And then advocacy, we do, in fact, I just left the NIH Rare Disease Day. We work in the rare disease space for advocating for things that will help it day to day for our folks to live a good life, to be able to afford their care, et cetera. And then we also work with organizations like American Heart Association in a lot of the heart-related advocacy efforts. So that is really important to us in terms of again, helping everyone that we serve live their best life. And then the next slide. Whoops. I don't know if you can see. Oh, I'm advancing slides. Sorry. The genetic testing initiative that was mentioned is our newest initiative, and that is really to advocate for every person and to get the message out to every person in the SADS community. If you are diagnosed with a SADS condition, you should be genetically tested. Not everyone is going to find, their genetic cause, but a lot of folks, as you heard, do find their genetic cause, and it really helps to diagnose other family members. So it's not the only thing that could diagnose you, but it's definitely something in the picture of diagnosis that would really help. Determine therapy. In a lot of our conditions, almost all of them now, there is specific things that are done, specific medications, et cetera, based on your specific mutation. So that is really important. And then obviously, who else in the family do I need to know about, and can I do, testing in that way? And then with research and clinical trials on the horizon, that is 100% what you need to have if you're going to participate is, your family mutation. So, and then my last slide is just our website. And I encourage you, if you have any questions or concerns or know someone, almost any time that I talk in a group in real life, there are people that come up later that have had something in their life that might be someone with a SADS condition. We would be happy to talk to you, give you, information, etc. So thank you very much for having me. It was very much a pleasure.